All right. So question number 2. Which of the following conditions is this patient most likely experiencing? What is this sign called? Great owner sign. What is great owner sign representative of? Where, what are some of the conditions in which you see a great owner sign? The two most common conditions are acute pancreatitis and retroperitoneal hematoma. Okay, let's read this patient's condition and tell me what do you think she has. A 55-year-old woman brought to the emergency department due to sudden onset of retrosternal chest pain. An ECG shows ST segment elevation. A diagnosis of myocardial infarction is made and later confirmed by elevated levels of troponin I. The patient is sent to the cardiac catheter laboratory to undergo PCI, percutaneous catheterization. She has two occluded vessels in the heart. The patient undergoes PCI to implant two stents in her coronary arteries, and the blood flow is successfully restored to the affected arteries. The patient complains of flank pain during post-procedure evaluation a few hours later. A significant drop in hematocrit is observed, as well as decline in her blood pressure to 90/60. The physical examination reveals extensive ecchymosis in the flank as well as the loin, as shown in the image. What do you think is happening here? I'll show you the options. Yeah, it was an easy one. Apart from retroperitoneal hemorrhage, could you tell me some more complications as a result of femoral artery access? The most common, we're just going to talk about the complications that USMLE is interested with. Rare hemorrhage, this is hemorrhage. So, okay. So, as a result of femoral artery access, what happens is you can get first when you insert, you're basically puncturing a blood vessel, right? So, first is it could lead to a hematoma. Now, that hematoma could be external, and if there's an external hematoma, it can present with a systolic bruit. Okay, so you're going to get a systolic bruit, external hematoma, basically under your inguinal ligament. Right. Then second and most commonly frequented complication is AV fistula. So what happens is when you're puncturing your femoral artery, it can form an aberrant connection with your femoral vein. And what would be the presentation of an AV fistula? Yes, this bruit is going to be what? Systolic or diastolic or both. So just remember pregnancy, severe anemia, hyperthyroidism, and AV fistula as the possible complications of high output heart failure. Okay, so those are, you will be asked to differentiate between these three things: either a hematoma, an AV fistula, or a hemorrhage. Right. So this was a retroperitoneal hemorrhage as a result of femoral artery access. So how do you do PCI? You always enter through the femoral artery, right? Then from the femoral artery, you go to your common iliac, like femoral artery, you go to internal iliac, then you go to, I think femoral artery goes to external. Yeah. The femoral artery, external iliac, then you go to the common iliac, you go to the aorta, right? And from the aorta, you go to the coronary artery. Okay? And that's how you access it. So this was your characteristic Great Turner sign. Okay, and so there's Great Turner sign, right? This patient is in what type of shock? His blood pressure is 90/60. What is the type of shock here? Is it septic shock? Is it hypovolemic shock? Is it cardiogenic shock? Is it distributive shock? Is it obstructive shock? Or is it neurogenic shock? It's hypovolemic shock, right? Because of the loss of blood in the retroperitoneum. See, you can have two types of hematomas or hemorrhages as a result of the femoral artery puncture. You can have a peritoneal bleeding and a retroperitoneal bleeding. What is more severe? So then we discussed the other complications of femoral access. It could just lead to a hematoma here, right, which would have a systolic bruit. It could lead to an AV fistula, which would have a both systolic and diastolic bruit. It would have a continuous bruit. All right. How much fat embolism present? So your fat embolism is classically going to present with hypoxemia. So you'll have decreased saturation of oxygen, a petechial rash, and neurological symptoms. So these are the three most important findings that you're going to get in case of a fat embolism. Okay. Now tell me, how is a patent ductus arteriosus going to present? Option C. So a continuous machine like murmur is PDA. So you're going to get it both in systole as well as diastole. Okay, tell me one scenario which is very important for you to remember, where you're going to get adrenal hemorrhage. Let's say upper arterial, upper extremity hypertension is coarctation of aorta. Okay, it's not seen in patent ductus arteriosus. You usually see upper extremity hypertension and lower extremity hypotension in coarctation of aorta. Got it? Adrenal hemorrhage, you see it in meningococcemia. The bacteria is Neisseria meningitis, and this is called as Waterhouse-Friderichsen syndrome. Very important to remember. Okay, what is the type of rash that you see in meningococcemia? It is a petechial rash. Okay, just like a fat embolism. You see a petechial rash in Neisseria meningitis, and if there is, if you're suspecting meningitis in those patients, what is the drug of choice? Pharmacology. Drug of choice for Neisseria meningitis, only ceftriaxone, plus you give two drugs always. In case of meningitis, you give both vancomycin plus ceftriaxone. Okay, do remember that. What if it's an old person who has meningitis, a person who's more than 65? What drug will you add in addition to vancomycin plus ceftriaxone? What organism what organism leads to meningitis in immunocompromised people and old age? Listeria. Listeria, and you would add ampicillin to vancomycin and gentamicin. Okay, so that is an important thing. Then VST can lead, you see VST in tetralogy of Fallot, or you can see it post MI. Okay, so those are the important things. You see a harsh polysystolic murmur, left lower sternal border.
Thanks for watching. Please give a thumbs up and subscribe for more.